Hey y'all, if we're just now meeting, hi, I'm Stacy. I'm a paramedic instructor, and today I want to talk about something cardiac. So let's talk about high lateral myocardial infarctions. So first, let's start off with a definition. A high lateral MI or a high lateral myocardial infarction is a type of heart attack that typically indicates the occlusion of the first diagonal branch of the left descending coronary artery. And just like with any other heart attack, this obstruction or occlusion hinders the oxygen delivery and the blood flow throughout the heart and can cause an injury or ultimately death. When addressing some of the characteristics of a high lateral MI, you're going to look for ST elevation in your high lateral leads, which are 1 in AVL, but you're also going to look for ST elevation in V2. And oftentimes the ST elevation for this type of MI isn't super pronounced, so it may not be over 1 millimeter. But if you see even slight ST elevation in these three leads, you might be suspicious of a possible high lateral MI, especially if you see ST depression in your inferior leads, but most pronounced in lead 3. Something unique about the specific type of MI is what they refer to as a South African flag sign. If you see a South African flag sign present, it is most likely a high lateral MI, and it's just referring to the ST elevation that is present in lead AVL 1 and V2, and there is the ST or reciprocal depression in lead 3. Now, like I said, there will most likely be reciprocal depression in your inferior leads, but specifically in lead 3, you're going to see the reciprocal depression. And causes and risk factors of a high lateral MI are pretty much the same as any other type of heart attack. It could be hypertension, smoking, obesity, a sedentary lifestyle, high cholesterol, heart disease, past heart attacks, and those sorts of things. And your patients will be complaining of things that patients complain of with heart attacks, right? Chest pain, abdominal pain, nausea and vomiting, feeling of dizziness, like they're going to pass out, impending doom, fatigue. And then, of course, we know with our heart attack patients, they could be severely diaphoretic as well. So what can we do as EMS providers out in the field for these patients? Obviously, if we don't have a 12 lead, we don't know for sure that our patient is having a STEMI. We may walk in and see them severely diaphoretic, complaining of crushing chest pain, and suspect it, but we won't know it until we hook them up to the monitor. And obtaining a set of vitals, administering oxygen if the patient isn't already satting at 94% or above on room air. We want to avoid hyperoxemia. We don't want to make the injury larger, right? IV access, if your hospital requires a blood draw or if you're able to get a blood draw for the hospital, aspirin, nitroglycerin, some sort of narcotic analgesic, that could be fentanyl or morphine. I know the services around me have pretty much moved away from morphine as an analgesic for chest pain, but I know there are still places out there that preach it, so Mona or Fona. And of course, we want to treat our patient's complaint. If we have a living, breathing, talking patient in front of us and we've treated what we could with the chest pain and now they're complaining of nausea, then we don't want to become so hyper-focused on chest pain protocol that we forget we could do something for nausea. So administer some sort of antiemetic. And of course, report and transmit your findings to the hospital, call a STEMI alert, or just follow whatever the protocol is that you have locally. And that's pretty much all I have for high lateral MIs. I hope that this was helpful. And if you have any questions, make sure to leave them in the comments. At the same time, I would love to hear about any experiences you may have run into out in the field with a patient having a high lateral MI.